Hi, I'm Judy Karshmer, and I have the outrageous good fortune of being the Dean of the Edson College of Nursing and Health Innovation at Arizona State University. And I'm delighted that you're joining me here today, those of you that were recording as well. So I'm going to talk for a while, and then we'll have questions that we'll do it at the end so we can make sure that we get them recorded. So keep in mind questions that you have. But I'm going to start a little bit. I want to tell you a little bit about who I am and how I got here. So I happen to be a nurse. I know some of you are in our college are not in nursing major, or maybe want to be in the nursing major, but I decided to be a nurse according to my family very early on, like when I was really little. And part of the problem is back in the dark ages when I was growing up, it didn't seem like there were that many options available for me as a girl. That teacher, nurse sort of seemed what it looked like I was going to be. And I wanted to be a nurse. So I cleverly decided, I'm from Iowa, I grew up in Iowa, that I would go to the University of Iowa because I thought that would be really sort of fun to go to a university. Because back in those days, lots of nurses were educated at what we call diploma schools of nursing. So I chose the University of Iowa. I got there and I had to do a pre-nursing semester year to get my grades to a certain point to get into nursing. So those of you that are nursing majors know the anxiety of getting in. I was so clueless I didn't even know that I should be nervous about it. So I was fortunate to get into nursing and got halfway through my career in college and said, this is not what I want to do. It's not at all what I thought. I didn't like being in the hospital. I didn't like sort of the craziness of the acute care setting, and so I decided I'd leave nursing, only to find out that the University of Iowa requires a foreign language for every major except nursing. And now I'm a junior, and I'm thinking, I needed 2 years. So I was going to delay my graduation. So I said, well, I guess I'll stick it out and see what could happen. And my senior year, my first semester senior year, I went into psychiatric nursing. And it was like coming home. I know that sounds a little weird. They put us on a locked unit, locked us in, and I thought, I've never felt quite as comfortable as I have. And so my classmates who loved the hustle and bustle of the acute care setting, they were scared, and I was like at home. And what that lesson for me was that the beauty of nursing and healthcare is this is not a one-size-fits-all profession. Any of them are. And that you can choose specialty areas, you can choose career paths that are quite disparate and very varied. So I ended up loving psychiatric nursing. It's exactly what I wanted to do. And when I graduated, I realized, well, I don't know nearly enough about how to be a psych nurse after one semester. I should go straight on to graduate school. Now you have to understand, this was the dark ages, and there were only 2 graduate schools in the United States that allowed you to go straight on without 2 years of experience. Every other school said you got to go work as a nurse for 2 years. Fortunately, I was able to find one of these 2 programs. Where I went was Rutgers University in New Jersey. And the good news is the director of the psychiatric nursing program was this very famous woman. Her name is Hildegard Peplau. And if you're in the nursing program, or if you're a nurse, you've heard of her name because she was the director of that program. And I got into this master's degree, finished my degree, and I was teaching nursing at 23. Now, when I get to my first job, 23, just finished my master's degree, I went to the University of Massachusetts in Amherst, and I was the only member of the faculty who had not gone to a diploma school and then gone back to graduate school for a master's degree. So who did they put me in charge of? I became the advisor for every diploma graduate in that program. And it was like, why? And what became clear to me is they were being mean to those nurses. They had gone to a diploma program, had worked as real nurses, and now were coming back for their baccalaureate degrees, and they were making them repeat fundamentals. I'm not kidding. They were repeating these courses. I thought that was a little crazy. So I said, well, how come they're doing that? And they said, well, because the accrediting body makes it so. I said, that doesn't make any sense. And they said, nope, that's the rule. I said, okay, I want to go off and be trained as an accreditor. So I did, and I came back and I could say, nope, that's not true. We don't have to make them do that. So I have spent so I tell you that story because my career has been around questioning some of those given rules. And it is something that I like to appeal to students to always do. When someone tells you, well, that's the rule, my response is, well, where did that rule come from? Many of the rules that we have made in nursing education, healthcare education, are rules that we made or we inherited. So as you move forward in your careers in nursing, in health professions, and in integrative health, in health innovation, then your responsibility is to not just accept that's the way it is, but question it. I often tell, any of you want to be educators someday? Okay, if you want to be an educator, my best advice is if it doesn't make sense to you as a student, it probably doesn't make sense to you as a faculty member. So don't ever repeat something that you thought, that really didn't make sense at the time. So I had the good fortune of then teaching nursing at the University of Massachusetts, decided that I wanted to do a PhD. So my PhD actually is in social psychology. This was so long ago that we had very few nursing PhD programs. And it was before we invented nurse practitioners. So I'm a clinical nurse specialist in psychiatric nursing. And so I started a PhD program, and then my husband finished his PhD, and he had a fellowship in Israel at Hebrew University, so we moved to Israel. And I taught nursing at Hebrew University for a year, fabulous experience for me. And I got to know, I had the good fortune of getting to work with students. I taught in English, by the way, at Hebrew University, but I had the good fortune of teaching community mental health nursing, and the clinical experiences for all those students were to actually work with Holocaust survivors who had immigrated to Jerusalem. So it was quite it was very a rich experience, and quite, I learned a lot, and it was very painful as well. But it was I think the vivid time in my life that your career is more than you providing services, it's what you learn from the people you're working with. So at the end of the day, the students and I learned more from those folks than services that we provided to them. The joy of a health professional is that you get to do that all the time. So fast forward, we came back from Israel, went to New Mexico. So I was in New Mexico State, and then I decided that I'll finish my PhD there. Did that, and over the course of 20 years, on and off, I was at New Mexico State. We started a baccalaureate program. We started a master's program. I had the good fortune of working to start a master. At the time, there was only one master's in nursing program in New Mexico. It happened to be the University of. So I went to our school administrators. How can we start a master's degree? Said, you'll never get approval. Those people at UNM, they'll never approve. Little rivalry, New Mexico State, University of New Mexico. So I went to my colleagues at the University of New Mexico, and they said, oh, please start a master's degree program. There is no way we can service a huge state like this. In fact, we want you to do it so badly, we'll appoint you to our faculty, and you can teach our courses till you get the approval. It was the same kind of thing that people said, no one will ever let you do that. And of course they let me do that. They let you do that because you have a good idea and a way forward. So we started a master's degree program in Las Cruces. It was great. We were able to I think they're still the only 2 master's degree programs in the state of New Mexico. It's a big state with not a lot of universities. But then I have a couple of kids, and they went off to college, and it was an opportune time for us, my husband and I, to try a different experience. I had never worked in an academic health science center, and I had the opportunity to do that. Went to Florida, went to the University of South Florida as the associate dean. Did that for a while. That was great. Learned a lot about how to run a PhD program. We started the first DNP program in Florida. Had the opportunity to start a master's entry program in nursing, and then was recruited to USF. So I was at USF, University of South Florida, and then was recruited to University of San Francisco. It worked very well because the colors are the same. Green and gold, green and gold. I have a whole bunch of paraphernalia that work either way at either school. If you're west of the Mississippi, it's University of San Francisco. Once you go east, it's University of South Florida. So I was dean at the College of Nursing at the University of San Francisco for 10 years. During that time, we grew the school from a school of nursing to a school of nursing and health professions. It was very exciting to do so because I'm a firm believer that healthcare is a team sport. And you cannot do this by yourself, and you should embrace the opportunities to work with colleagues across disciplines. So in San Francisco, we started an MPH program, a clinical psychology PsyD program, health informatics, behavioral health, and really had the opportunity to think of healthcare in a very integrated way. In terms of the fact that providers, the first person that a patient or a client or family sees could be a psychologist. It could be a MPH provider. It could be an undergraduate behavioral health student. And that it's the responsibility to then learn how to differentiate as the student, as the needs of the patient. So I loved that opportunity. But I always said I was like a 5 or 6 year kind of girl. I didn't want to hang out too long. And when I was in my 5th year, the provost said, how could we keep you for another 5 years? And I said, okay, we'll do this for 10 years. 10 years came and I said, that's it. 10 years is about all I think I'm effective in one location. So I had the great opportunity to take a sabbatical. And it's a pretty crazy 10 years, but a sabbatical gave me a chance to work on a clinic that had integrated health as its framework with a variety of health professionals. And gave me the chance to think, what do I want to do next? And ASU came calling. Best thing that happened. I, of course, knew of ASU. I had been here before. I had known previous deans of the college. And I'd heard President Crow speak a couple of times. And I thought, that's a happening place. I'd love, if it's the right match, I'd love to be part of that environment, that sort of can-do attitude. So good fortune, I came in last June 1st, I started my job, so I've been here 10 months, 11 months. And in fact, I came in May. I was still on the faculty at the University of San Francisco. I came in May and the president had a leadership 2-day bus experience. We went to all the campuses, Polytechnic, the West Campus, the downtown campus, Tempe. I never made it back to San Francisco because I got caught up in this sort of vortex that is ASU, this sort of ongoing, wonderful energy space. So I came to, and I haven't left since. Well, I've left, but I'm still here. I travel a lot. So that's sort of my background, and I tell you that because I have had a wonderful opportunity to go to be at public universities, at private. The University of San Francisco is a private Jesuit university. I've had the opportunity to work with nursing professionals and non-nursing professionals. And I am absolutely confident that what makes ASU Edson College so powerful is the fact it's interprofessional, we have many disciplines, and we have a faculty and staff opportunity to work together to really move forward in terms of healthcare. So I'm going to do a couple of slides here. I had the opportunity to speak at the President's Philanthropic Luncheon, and I described this as not your grandmother's nursing school, because I think some people think of nursing school as a bunch of girls who go off and they work in hospitals. Girls are great, hospitals are great, but we do so much more than that, that I like to make sure that people realize that we have nursing, we have community health, we have integrative health, we have care coordination, we have entrepreneurship and innovation, we have master's degree, undergraduate programs, we have master's degree programs in health innovation, we have master's degrees in nursing education, master's degrees in nursing, master's degree in the only accredited CRM, clinical research management master's degree. We have master's degree for the opportunity, regulatory science. And then we have a PhD program that is for nurses. It's a PhD in nursing and health innovation. About half our students are nurses, and about half of our students are non-nurses. About half the faculty who teach in that program are nurses, about half are non-nurses. And then we have this amazing DNP program to prepare nurse practitioners across a whole spectrum of specialty areas, including psychiatry, but we also have pediatric acute care, and we have family nurse practitioners. We have adult gero nurse practitioners. We have leadership and innovation, preparing that generation of nurse executives. So we have a huge array of opportunities. We have researchers. And let me just say a little bit about the size of the college. So this is an enrollment growth slide. In 2011, we had 1,470 students. 2018, we have actually now surpassed that. There's almost 4,000. We now have more than 4,000 students. Our move to the downtown campus about 12 years ago, our expansion to nursing and health innovation has really allowed us to grow our, and by the way, in 1957 when we started, 58. So we're a few more students than we used to have. ASU is not only a powerhouse in workforce development, preparing the next generation of health professionals, but we're a powerhouse when it comes to research. And so our research expenditures in the college have gone exponentially up. We pride, our President Crow and the university prides ourselves that we do it both. It's not just education, yay. It's not just research, yay. It's both of those together. And that this research is community-embedded research, that it's about making a difference around those priority issues that we believe in. It's quite a wonderful experience to get to talk to our researchers about the kind of work they do. I love lab science, but so much of what we do is in the community. It's working with families, and we're only going to grow in this area. I want to spend some time talking about the future of the college, but I want to first go to this slide. So you all heard that about 2 weeks ago, the announcement came out. In fact, I think it was 2 weeks ago on Monday, that the college is the recipient of a $25 million gift from the Edson family. Who hasn't heard that? Okay, everybody heard that. Everybody's heard that. It is a transformational gift to the college. Let me talk a little bit about why the college got the money and what we're going to do with that. By the way, we don't get to just go out and spend $25 million. When the president connected us to the family, I thought, well, could we take like a skim, maybe $1 million off the top and spend that? No. All of the gift goes straight into our endowment, and so it's going to be there forever. So your kids, when they come here, they're going to be able to benefit from the Edson gift. And what we're able to spend is the endowment, the growth from the interest off that every year. But it's very specific what we're doing with this money. I think it's also important to know that the university invests in the college as well as the donors. So in addition to the $25 million, of which I'll talk to you about what we're going to do with that, the university committed to 3 additional key positions in the college. And one of them is the endowed chair in dementia translational science. Let me tell you what this family is particularly interested in curing the devastating illness that is Alzheimer's and dementia, cognitive issues. And they also have given $25 million to the Biodesign Institute to find the cure for these problems. We only hope and pray that that will be the case. However, the family also realizes that families today are dealing with dementia and cognitive impairment and neurological brain disorders and degenerative diseases, and that takes a huge burden on both the patient as well as the family. And so the family decided that key to this is not just the cure, but the care today. And that who does that care? It's a College of Nursing and Health Innovation, the people that we prepare that are going to advance this. So they were particular in saying we want 25 million to go to nursing and health innovation and 25 million to biodesign. Now, the beauty of this is it's going to link our two units together. So our chair in dementia translational research is the health provider science that will also link back to biodesign. So we can truly go from bench to bedside. Research that looks at the causation to the treatment, to the how do we fix it prevention, to how do we help care for those families. So dementia translational science is about the dementia, but it's also the translation of that, family caregiving, how to support families, how to help people with dementia live the most profitable, productive, satisfying lives, because you're going to live with it, and we want to make sure that it is as positive as possible. So that's a gift from the university to match the gift from the Edson family. The whole dementia area is what they're investing in the college, and so we're going to be able to advance the dementia research in the college in two key areas. The first is we are designing a dual degree. Now, hang on, because this is going to be your future. A dual degree for preparing adult geriatric nurse practitioners and PhD students in dementia caregiving research. Now, that may not sound hugely amazing, but it's hugely amazing. You have to believe me on this. It's hugely amazing. So you've already heard my story. I've been doing this forever. So when I say I have been in nursing education, listen up. I've been doing this forever. But I think I have contributed to a problem in our profession, nursing, not to exclude our health professional colleagues, but this is about nursing right now. When people come to me and say, yeah, I always give advice if anybody asks for it, by the way. I have a lot of rules of thumb, but one of them, if somebody asks for advice, I give it. Of course, no one ever listens, but I always give the advice. So people would come to me and say, Judy, what should I want to get a doctoral degree. Should I get a PhD or a DNP? I mean, I must have been asked that 100 times. And I would say, well, tell me, what do you want to do? Are you interested in research? Then get a PhD. We really need researchers, yay. Tell me about what you want to do. You want to be a clinician? Yeah, I think I really want to be a provider. Yay, then get a DNP. And so I have been, for the last 10 years, channeling people to get a clinical doctorate or a research doctorate. And that's what our profession has done. By the way, I'm not that special. We've been doing that. We've been channeling people one way or the other. What I realize is that we have been doing a disservice to the research and practice agenda. And what I should have been saying, how can I help you prepare as a clinician researcher? How can I help you advance your role as a provider and learn the ropes of being a researcher? Because we end up finding that, which is great, I love the team science, so we get DNP prepared folks with PhD prepared folks and they become great team, that's great. But it adds a barrier if there's not also someone who is both, who has both preparations. So the beauty of this gift is we now will have scholarship funds to pay for people to get this dual degree at ASU. We will be one of 2 programs in the country, Johns Hopkins is the other, that has a fully integrated PhD DNP program. Ours will be a fully integrated PhD DNP program around this area, gero, adult nurse practitionering, and dementia science research, family caregiving. It's broad enough to include a lot of interests in there, but that's really going to be the focus. Many schools will help people who already have one of these degrees get a degree, but it's almost like 2 stacks, 2 separate. This is going to be fully integrated, so the clinician researcher at the end of the program will be fully able to embark upon a career that includes seeing patients in clinic and doing the research to help them get better on a regular basis. It's a way that we're trying to conceptualize that this is what many of our physician colleagues have done who became physicians and became researchers at the same time and still see patients in their pulmonary clinic on Tuesdays and then do the research on Wednesdays in their lab. So I'm very excited about this. That curriculum is currently being designed. We will be advertising, so hang on, for fall. This fall, you can start applying for that program if you're graduating with a baccalaureate degree in nursing, starting as a student next fall. Very cool. But that's not it. That's not the only thing. Remember, we're an integrated interprofessional program. So we also have funding for postdocs. So people who already have a PhD or a DNP, so non-nurses who want to be researchers in this area of dementia care, dementia science, cognitive problems, neural disorders, we will be able to fund postdocs. So now we have pre-docs, we have postdocs, we have nurses, we have clinicians, we have non-nurses. All of a sudden, our team gets pretty amazing. And so we think that this will be a huge way forward in the dementia science world and a huge mark for ASU, Edson at ASU. Now, that's not all. The other thing that, as I said, this family was fully aware of is that the care of the people who are suffering from these very chronic, long-term suffering diseases is at the core is nursing. The wife, Charlene Edson's, her mother was a nurse, so she has a special spot for nursing. She wants us to prepare more nurses. Oh, who doesn't want us to prepare more nurses? So I want to prepare more nurses. I'm really not happy about this is one of my goals for myself. Everybody who wants to be a nurse, who's prepared to be a nurse, who has the background, gets to do that. That's one of my goals for the college. It's going to take a while, but I'm working on it. But one of the things that we have done is starting in the fall, this fall, like in 5 months, we're starting a master's entry program for college graduates, like community health graduates or integrative health, whatever, who have the prerequisites, can apply and go straight into a master's degree program. It's a 5-semester master's degree. You prepare as a new nurse while earning a master's degree. Now, I have done these programs in 2 other universities. They are wildly successful. They're amazing students. I like to tell the difference between a regular I love baccalaureate students, so this is just a picture of the difference between a baccalaureate, most typical baccalaureate student, and a master's entry student. My previous university, we had both these programs, loved them. I'm in my office one day and I had a whole clinical group come in. We want to talk to you. It's not fair because the schedule says that clinical at the hospital starts at 7 a.m. And my our faculty clinical instructor makes us come at 6:30 to get prepared for report. It's not fair. That's not the schedule. Okay? About 3 days later, a group of master's entry students came. Dr. Karshmer, the schedule says 7 o'clock. Our instructor won't let us come before 6:30. She says that's the earliest we can get there. So it's just a different way of thinking. These master's entry students have 5 semesters to learn everything there is to be a nurse and prepare with a master's degree. So we're going to start that this fall, and we are committed through the Edson funding to hire the Edson Director of Academic Practice Partnerships. And through this person that we're hiring, these 200 new nurses will eventually be prepared every year at ASU. And they will all be these master's entry students in what we call academic practice partnerships. So we're not in any way changing what's happening at our basic baccalaureate program, our direct entry or the competitive entry opportunities. We are working with 20 partners. They can be 20 partners in a variety of areas that will be willing to take 10 students in one cohort for all their clinical experiences. So we are working right now with a partner that all 10 students will do the bulk of their clinical experiences in perioperative nursing. Pre-op, post-op, OR, cath lab, all the kinds of things. They'll get to do assessments, but it'll be focused on periop, and they will be work ready to be perioperative nurses. We're looking at doing 10 students, all in ambulatory primary care in a community clinics. Very different. Work ready for the ambulatory care setting. We're looking at doing this across specialty populations, as well as instead of us saying, I need a spot for 8 students on a med-surg unit on Tuesdays, which is sort of treating our partners like real estate, and saying, where do you need nurses? Where can we partner with you? Let's talk about the concepts that our students are learning. Where do you think they would learn them best in your facility? So we're trying to establish this as a true partnership that's not just education for the student, yay, but opportunity for the work-ready graduate to get employment there. And you're not stuck there, but it's a perfect way to say, I really like this kind of work, I like this facility, or not. I'm pretty excited about this. We hope to also have cohorts in Yuma. I've been to Yuma. Lake Havasu, been there. To really look at how we can prepare people who are from those areas, who want to do that kind of work. So we're trying to take ASU to a new level in terms of preparing the nurse scientist at the master's level through academic practice partnership. And I'm happy to answer any specific questions about any of these at the end of our time. But one more important part of the university's commitment to this, to the new Edson College, is the director of our center, Grace Center for Innovation in Nursing Education. Often, educational advancements are not supported by grants. It's not very sexy, it's not very cool, so it's hard to get funding. This family believes that the kind of work we do in our simulation center for nursing and non-nursing is pretty amazing, and so we are now going to have the director of our Grace Center for Innovation, it's going to be Grace, was Charlene's mom. So it's the Grace Center for Nursing, for Excellence in Nursing Education, Innovation in Nursing Education. So we're going to get to try out new opportunities. I'm particularly interested, as well as my colleagues in the college, in competency-based education. I don't know if you know about that. Let me just give you a quick descriptor of what competency-based education is in the easiest way. Any of you ever take swimming lessons when you were a kid? Yeah, you went to the summer, and to earn your, if you took Red Cross, to earn your like beginner's badge, you had to swim like from the end to the end without touching the bottom. Now some kids did that first day. They jumped in the water and swam across and got put in the intermediate class. And some kids were there all summer. I was there all summer. That's what competency-based education. How do we look at not seat time, but outcome time? How can we either minimize time at task or take more time at task? It's a huge initiative nationwide, and we want to make some of this new work in competency-based education alive and well at ASU. So we're going to be doing some pretty fun stuff. So those are the 3 positions: the endowed chair, the Center for Innovation director, and then the director of academic practice partnerships that are the university commitment to the college. Then the Edson monies will be used for the pre-doc, the scholarship funding for DNP PhD students, the postdocs, nursing and non-nursing around dementia and cognitive impairment research areas. And then we have funding for some startup seed grants in these areas, and that will be how we're going to use that money every year. So over time, we'll have a number of new pre-docs, postdocs, and then this whole 200 new nurses every year. So very cool. But that's not just what's happening in the college. I'm going to give you a quick overview of some other initiatives that we're doing so you get a sense of where we're going. And this past fall, the college, we launched 30-some progress groups of faculty and staff, cohorts of worker people on the progress groups to address everything from new degree options to joy in the workplace, the student experience to the onboarding experience for faculty and staff. And as a result of that, several things have come out of them. One is our new commitment to globalizing the college. It's a priority for the university. We're trying to make it a priority for the college. So we now have a new Associate Dean, Craig Thatcher, is helping to advance our globalization strategy, everything from student abroad experience to bringing students from abroad to sending faculty, to bringing faculty, to short-term immersions, to semesters abroad. So you'll be hearing more and more about that. We're very excited about the globalization of the college. He's also leading an initiative around executive education. We're going to be doing some partnering with Thunderbird. Thunderbird has a global footprint in executive education management. We're going to be linking with that work as well as opportunities for our executive leader DNP program. We have launched this month, had a soft launch this fall, our new Center for Aging. It's a Center for Resilience and, oh, I keep forgetting the name. It's the Aging Center, but it's got a much, much better name than that. Center for Resilience and Innovation in Aging. That Associate Dean David Kuhn is the director of. We're having a big launch this month, and that will not only help advance our work with our dementia researchers, but the whole area of advancing the science of aging. David likes to say that it's a way to bring together people from, like he does a project with the symphony and Alzheimer's. How do we get people from Herberger connected with the college? How do we really integrate opportunities to address these kinds of issues? What a better place than ASU in the middle of Phoenix to look at healthy aging and resiliency. So that's pretty exciting. And coincidentally with that is we're starting our new Master's of Science in Aging Studies, in Aging, which starts this fall. So that will be linked very closely with the center. In January, we start our new Master's of Science in Clinical Simulation. Those of you that have been to the Sim Center, you know it. Most of the people in simulation had on-the-job training or they went to workshops. We're going to have a whole master's degree in both how to run simulations, how to design simulations, how to evaluate simulations. That will be a big part of our Grace Center for Innovation in Nursing Education. And then we have the new master's entry program that you've heard about, and then the dual degree PhD DNP program. So we got a bunch of new things that we're doing in the college. And we have the opportunity for expanding to our California connection. Some of you may be from California. We have been sought out after our community college colleagues in California who want to provide opportunities for concurrent enrollment at ASU to get their bachelor's degrees. And we have an RN to MSN program where students with associate's degree can go straight through to the master's and get awarded the baccalaureate degree and the master's simultaneously. So we're trying to come up with alternate pathways for lots of people. I think that some of you have worked in the HEAL lab or know of our innovation work. The whole idea that we are bringing innovation and the idea of entrepreneurship to healthcare is something that we're being watched nationally. The director of the HEAL lab, Rick Hall, was just at the National American Association of Colleges of Nursing meeting where I was, and he spoke, and people were saying, he's in your college, you're getting to do that kind of stuff. Whoa. I felt pretty cool. Between that and $25 million, it was a good day for me. So we have lots going on. We're hoping to, as I said, go out to Yuma, go out to Lake Havasu. We're excited to provide opportunities through academic practice partnerships. Oh, the other one is with our practice partners, whether it's Banner or Dignity or Mayo, we're trying to look at how do we get joint appointments so we have researchers and clinicians that have a commitment to the ASU world as well as to the Mayo world or the Dignity world. And I think that anytime we can partner, we advance the ASU charter, which is really social embeddedness, really making a difference in the community. And it's not about us, it's about how do we do this together. So there's a lot going on in the college. I'm very happy to answer any questions. We'll open it up, and if you stand up and ask the question, and then I'll repeat it so we get it on the YouTube thingy. Yes?
Hi, my name is Erica, and I'm an AGNP student. I just started last fall.
So tell people what an AGN student is.
Adult gero nurse practitioner, so I'm getting my DNP, and then, so like she mentioned, there's several specialties, pediatrics, women's health, and then I'm doing the adult gerontology because I love the elderly.
So this is a question from the student in our NP program for the Gero NP.
So really exciting about the combo dual degree DNP PhD dementia research and the focus on the caregivers. You said that it'll open up and be available for incoming students on the fall, but what about people who already started? Is there going to be some sort of bridge program or opportunities, and do you have any idea about what it would look like as far as lengthwise, or if we could work on it like get my DNP, work in clinic, and be working, but then also getting the PhD?
So the question, just to repeat for the video, is congratulations for being in our DNP in the GERO program. It's very cool. So the question is, if you're already like walking down the path of getting your your DNP, what are the opportunities to take advantage of the dual degree program, and what would that look like? How long is it going to take? And I don't know. No, I am committed to making opportunities for those kind of for students like you, PhD students too, who are seeing the sort of, I sort of gave up on that dream, and now maybe I can come back and do that. It's going to be muddy. It's not going to be easy, because we'll have to, right now there would be courses you'd only have to take one of them because we'll have to sort that out. But I'm fully aware that we'll have students like that, and even although the program won't be up and running for new admits till a year from fall, I think by this fall, for current students, we might be able to start doing some double dipping.
Okay.
And I'm happy to say that out loud, because this way it helps push my colleagues to double dip as well.
Yeah.
So
I have other questions too,
Okay.
if you want to take
Okay.
some ones.
Okay. Yes.
You mentioned the globalization of opportunities for nursing students. What about for PhD students?
Good question. Globalization of the college, are there opportunities for PhD students in addition to nursing students? And yes. The globalization is across all the majors. Nursing is just one of those options. Associate Dean Thatcher just came back from China, where he talked to people about our health innovation program, the PhD in health innovation, opportunities for people to go, and opportunities for people to come. So I think that as we do this, it's going to be a full court press across all programs. You may know Dr. Reifschneider was just in China for last fall, and she's on a sabbatical now she's in, where is she? Someplace wonderful. Prague, she's in Prague. But again, she's forging ways for PhD students to have these connections and these relationships. So I'm fully confident that we'll have those kinds of opportunities emerging. Yes?
Hi, I'm Bobby Maxner. I'm in the psychiatric health DNP program. I was wondering if with the joint PhD DNP program, if you considered the psych people going into that program as well.
Good question.
Dementia is part of psych.
So the PhD in, the DNP in psych mental health, that's the one you're in, right? Yay. We're like buds. Could that be part of the dual degree scholarship program? And that's a really good question. I'm thinking that if the research area is around this dementia, caregiving science, neurological stuff, that we might be able to see how to make that happen. I don't know that for sure, because the specifics have not been signed off yet. But thank you for asking that question, because that's a really good thing for me to keep in mind. Yes?
I also received a graduate certificate in nursing education, so perhaps I could be someone that has input into forging a program like that.
Super idea, super idea. So one of the things that I have learned, that you can spend a lot of time doing ready, aim, fire, organizing your life, getting it, understanding, and then 2 years later you fire. Or you can use today's best thinking, look around, make sure you have all the information you can get, and make a decision and fire, aim, ready. And the only way you can do that is if you trust people with expertise, not like your own. So bringing someone who's in a program, who's got this experience, who just did a master's degree in nursing education, perfect kind of people to work with. Other questions? Yes?
I just wanted to confirm, so the students that are using health and go into the master's program, basically it's like getting the students that are already in the nursing program, getting
the new program that we're starting in the fall, you apply to it. It's a graduate program. You have a degree. You have the same prerequisites that are to advance in the baccalaureate program or the accelerated or the second degree bachelor's. You apply to the program. If you get in 5 semesters, you get all the pre-licensure stuff. You're eligible to take boards when you graduate. Yes?
Two things. I'll just I did the post-bac program, which is the secondary degree program, and I had a prior science degree, but it was really good, and that's why I came back to ASU for my doctorate, is because I felt like even though they got me a BSN in 1 year, it was really, really rough, and that's all I did was eat, sleep, and drink nursing, but yeah, I felt better prepared than some of my colleagues when I went to the hospital. So my next question is there a possibility of incorporating the research that the postdoctoral fellows are going to be doing, and our faculty as well are going to be participating in research through this endowment? Would there be any interest in incorporating the research into the DNP or PhD programs, into the actual course material, the assignments, and that sort of thing, so that it's almost like, hey, we're going to be using what's coming from your assignment. The faculty may use it as data in their big study that they're doing.
Okay.
So we're kind of like participating in it, but not necessarily having our name on anything, but to give us more of a taste of that.
So the question is around, I'm going to summarize the question,
Yeah,
that
sorry.
around the coursework and how that can contribute to the research agenda of a faculty member and vice versa, how you can participate. And that's not only true for our PhD, DNP students or our master's students, but we have a commitment to opportunities for undergraduate research as well. So yes and yes. What that takes is a faculty that thinks in a sort of a different way, that it's not just about coursework and it's not about research, but they're integrated together. And I think because we now will have this integrated baccalaureate and the PhD, DNP, it'll cause us to think differently about it. But I've just been meeting with my colleagues about the postdoc opportunities. And one of the things that I think is crucial for us to be effective is to not treat this opportunity like every other postdoc, which means you're poor for 2 years, you don't get much money, you know, that maybe there's some part-time postdoc opportunities. Maybe there's some ways that you could teach part-time and do a postdoc. Maybe there's some ways to be a nurse and do because quite frankly, the only way we're going to advance all of our professions is by taking what's not working and making it work. So yeah, I'm a big believer that so one of the other ideas is what I call research residencies, that while you're in your DNP or PhD program, you actually are sort of indentured to a system, a healthcare system, where all your work advances their priorities, not yours. Now you're learning how to be a researcher, but you're not making, I'm going to do this. You say, what is your priority at Dignity? And they say, well, we want this area. And so we're not just doing individualistic studies, we're in fact always contributing to the product of our partners. So the whole academic practice partnership goal is once that we get the 20 partners up and running, the next step is how to infuse research and a research agenda. And maybe every partner has a research residency for X number of students, DNP, a PhD. Maybe every partner has 2 masters in nursing education students. Maybe every partner has 3 masters in health innovation students. Maybe every partner gets 2 students from the clinical research management. So we start really integrating the college with our partners. That's going to take a few years, but we can, between that and everybody who's prepared and wants to be a nurse, gets to be a nurse, it's going to be busy. Other questions? Yes?
Hi, Catherine Tubman from Philadelphia, majoring in healthcare and entrepreneurship and innovation. And I wanted to know that for advancing the agenda, for more people to go into these programs, would there be will some of the donation go into producing more students to go into the nursing program? If so, how long do you believe that would take to happen?
So I've outlined what the money is earmarked for, and it's going to prepare more new nurses through the Academic Practice Partnership Master's Entry Program. So anybody who is a graduate of ASU with the prerequisites, or any other school, in the world who wants to come to ASU and earn a master's degree and prepare as a nurse, there'll be 200 new slots for that over the next, as we unfold this. We also have the opportunity, as I said, for graduate scholarship and postgraduate scholarships. So there's no money set aside for undergraduate students for this in this money, but we do have a host of undergraduate degree, scholarship opportunities that we have had for a long time. What we haven't had is at the master's and the doctoral level. So that's one of the things that we really have focused on. But let me just say that this year, you all know that in our nursing program, 64 was the magic number of direct admit. People go on. It's going to be 70 now, and the plan is by fall of 2020, we'll be up to 100. Okay. Other questions? I can't believe you spent your whole hour of lunch coming and listening. I'm pretty impressed. There are cookies back there. We don't take any cookies home, so take as many as you want. And if there's nothing else, I'm delighted to be here. And y'all know where I live. I'm on the 3rd floor of Health North. Yeah, and I have one more question. Yes? Yes.
Scholarship opportunities for doctoral in general, are we going to see an influx in scholarship opportunities for AGNP students?
Not through this funding. This funding is for the dual degree scholarship funding, but it's better than nothing. Better than
I'm just asking.
Yeah. I think our job is to look at other ways to provide funding for students. This is why I talk about these research residencies where you get paid by the hospital to come and be part of their research team. I think there's some ways that we have to think differently about raising money. We have a new director of our philanthropic world, Joshua Butler. He's tasked with funding for globalizing the college, funding for scholarships for undergraduate, funding for scholarships for graduate students. I mean, we have a lot of need. Be sure and give to the day of the giving, because we know our whole goal is to increase our philanthropic base so we can provide more scholarships.
And then one last thing. What? Can you tell I was the one in class that always asked all the questions? So you mentioned more than once partners like Mayo, Banner, and Dignity. I currently work for Honor Health.
Oh, Honor, one of
I didn't know if there was a particularly omitting that,
No,
but
no.
I know I see ASU students coming on my neuro for.
Honor's one of our BFFs. No, Honor's one of our BFFs. Maricopa, Tucson Medical Center, El Rio. These are all. No, it's just a slip of my.
Okay.
I think I haven't been saying Dignity and Mayo, so I was feeling bad about them. So I did a presentation yesterday with all the emeriti faculty. There was a faculty member there, it was so cool, who was teaching in this College of Nursing in 1968. She came to lunch yesterday. Yes?
The postdoctoral positions, will they be for global nursing?
Yes. Postdocs are for nursing and other professions. Absolutely. Thank you all. Thank you for coming. Have a good rest of your semester.